and then I'll mute myself and then start letting folks in, so you'll see them pop in.
Hi, good afternoon, everyone. I've got 1 o'clock. We are still having people join this virtual training, so I'm going to give it 1 more minute before we officially get started.
Tara, I don't know if you can see everyone or not, but I'm only seeing Motive Care and Partners people, maybe one other person, but I may be missing some folks, but just the FYI.
Thank you, Lachey. Yeah, I'm seeing several folks in the audience. So let's go ahead and get started. Again, good afternoon and welcome. My name's Tara Conrad. I'm with Partners Health Management. And I wanted to take a brief minute to introduce some of the members on our panel discussion today. We have Abby Cole, who is with Partners, and she is the one responsible for setting this up for us. So thank you, Abby. We also have Jackie Copeland, who's a regional director for our Davie and Forsyth counties. We have Jeff Eads, who's a regional director for Surrey, Yadkin, and Iredell counties. Holly Wall is regional director for Gaston, Cleveland, and Lincoln counties. And Lachey Avery is our regional director for Cabarrus, Stanley, and Union counties. And I will kick it over to Toby to introduce her team.
Good afternoon, everyone. My name is Toby Everett Santiago. I am the Senior Director for Transportation here with Motive Care, and we are pleased to partner with Partners Health for these tailored plan members. So my team, I have with me Sherry Koster, who is our Director of Network and Account Management. I have, let's see if I've got, well, we will have probably in a moment or two additional team members for Motive Care. That would be Anita James. She is our Provider Relations Director. And then we will have Tanya. She will be the Provider Relations Manager for the Partners account. So you would deal directly probably with Anita, myself, and with Tanya.
Thank you for that, Toby. And again, we want to welcome you to this NEMT training. We hope it will provide you with some valuable information and an opportunity to ask questions. So feel free to go ahead and put questions in the Q&A feature or through the chat feature throughout the training. And we will open it up for you to verbally ask questions at the end of the presentation. So with that, I'm going to turn it over to Toby and Abby to start the presentation.
Thank you so much, Tara. Well, again, good afternoon, welcome. We will review a quick presentation to give you an overview of what contracting with Motive Care looks like. This is the North Carolina Medicaid Tailored Plan contracting, and the current go live date for tailored plans is October 1st. 2023. Next slide, please. We will give you an overview. So we will begin with the tailored plan map. Our second item on the agenda will give basic contracting steps through us, Motive Care. We'll also discuss tailored plan contracting the team. So you'll see photos of the team that we just introduced. And then, of course, as we previously stated, we'll have time at the end for questions. And now the tailored plan map. If you were unfamiliar, standard plans are in 6 regions for the state of North Carolina. Tailored plans are in catchment areas, and Partners, second down, is in a lovely shade of medium blue. As you can see there. MotiveCare, we are the NEMT broker for 5 of the 6 LME MCOs. Partners alphabetically fits in number 2. We'll go to the next slide. Thank you. Sherry will walk us through our NEMT contracting steps, step by step.
Thank you for the introduction, Toby, and good afternoon, everyone. Some of you on the line I do recognize, and I think we've met in person. Timothy, Vince, good afternoon. But for the MotiveCare contracting process, MotiveCare will manage all non-emergency medical transportation services for members of Partners Health Plan with the Tailored Plans launch of October 1st. To contract with MotiveCare, we would need to set up an initial meeting to contract face-to-face or virtually if you prefer, but we would go ahead and set up that contracting meeting. You would need to be NC Tracks approved, have workers' compensation insurance if you have 3 or more employees. We would discuss rates for the counties you service and the levels of service in the areas. We would do your NC registrations for each vehicle, insurance card for each vehicle. MotiveCare does do their own set of inspections for each of your vehicles. And then some additional information that we collect is your driver's license for each driver that you're enrolling with MotiveCare. MotiveCare's insurance requirements is for your auto liability is 1.5 million per incident, 100 million per aggregate in broad form coverage, including contractual liabilities, as well as liabilities for sexual abuse and molestation, which is the SAM coverage. For taxis, we require just the 1.5 million, and we will take insurance as is with simples 28 and 9. For ambulance, we only require the 1.5 million per occurrence. And then again, for the workers' compensation, if you have 3 or more employees, then we require workers' compensation. If less than 3 employees, owner operator, we do not require workers' compensation. Again, continued for your driver's requirements, we do require a clean copy of the driver's license, an Office of Inspector General, your OIG check, as well as your SAM exclusion check, a 10-panel drug screen, your criminal background check going back. If a non-resident, this is actually, I'm sorry, there's just a typo in here. This is going back 10 years, and then a recheck every 3 years. Driver requirements continued. These are the exclusions that would disqualify you as a driver: murder, rape, kidnapping, felony assault, felony crime, unlawful possession, use, or sale, distribution, or manufacture of any explosive device or weapon, elder abuse, child abuse, illegal sale of possessions of a Scheduled 1 or 2 controlled substance, or conspiracy to commit any of the above. For the driver training, you can find all of these trainings listed on MotiveCare's website, but we do require your PASS Basic. PASS Wheelchair, if you're providing wheelchair services only, that is a 2-day course that MotiveCare does host. And it just goes over all of your wheelchair securements. It takes place of the PASS Basic if you are doing wheelchair. We do require first aid CPR, which also can be done online, as well as defensive driving. The Americans with Disability Act, emergency procedures for vehicle operations, and illegal drug use. For the vehicle requirements, we do ask for your current registration. Not necessarily state inspections, because MotiveCare will be doing their own inspections. And then for each vehicle, just a copy of the insurance card and the vehicle registration in vehicles. We ask that, or we do require that all of our provider network is on a digital platform. We offer WellRate at no cost to you with a rebate behind that program as well. Your digitization is going to allow for better on-time performance, smoother operations, improved member and TP experience. It's going to increase revenue, again, with that rebate plan coming back to you. If you would like more information regarding the demo, that will all be sent to you at the time of contracting or via a virtual session. And then you can go to the next slide. Again, Toby, thank you for introducing us all, but Toby Everett Santiago, she's the Senior Director of Transportation. I've been in the market since launch of 2019, so some of you have probably met me in person, but again, my name is Sherry Coster, Senior Manager of Network Operations. Anita James is fairly new to the team, but she's our Director of Provider Relations, as well as Tanya Townshed. She's the Provider Relations Manager over all of Partners regions. Joy Hagens is also another Provider Relations Manager, mainly dealing with the transits, but we'll lean in anywhere to help. All of our contact information, and we'll also be sending out this slide so you'll have it on hand. And then we can go ahead and open it up to questions. For any of the attendees that are on, you may be on mute if you do have any questions. Timothy. Timothy, you're back on mute.
Hey, Sherry, just gonna have a quick question about the rates and how, they are kind of negotiable, I guess. Are you guys gonna send us the starting rates for those, or, how do we get started on that?
Yep, absolutely. So you'll work with Tanya, and she's going to be your contracting partner. She will go over all of your rates, level of service, and the areas that you're going to be transporting in.
Thank you.
You're welcome.
So Sherry, this is Tara. Let me just clarify. Does the provider need to reach out to Tanya, or will Tanya reach out to the provider?
We can go ahead and reach out to the provider. Again, on this slide, you're going to have all of our email information, but we don't have yours. So Timothy, if you want to throw your email information in the chat line, as well as the company you're working with, we can go ahead and reach out to you after this call.
Thank you.
You're welcome.
And we will be sending out a recording of this to the transportation providers. So you'll get it two different ways. Tim. Other questions?
Quiet group this afternoon.
Oh, Tim, I have your information. I've been working with you and your brother for quite some time. So I'll shoot you an email after this.
Thanks again.
You're welcome.
Any questions about credentialing or going through NC tracks? I know our team heard that frequently while we were doing some outreach efforts.
Yes, I do have a question about that. This is Denisha.
Hi, what's your question?
Hi, how are you? With the credentialing, what all would you have to do to get your credentialing? Because actually, before I received this email, I was already in the process. I've been, reaching out to Care and, trying to get set up with this before this training come about. And I just want to know I'm actually on the right path.
Okay, so with for Motive Care's credentialing, we offer resources at a much discounted price for you to go. You can use OcuScreen, and I can send you all of that information. You can do your background check, drug screening, and motor vehicle check all through OcuScreen, again at a discounted price. You can access Motive Care's safety card for the PASS or CPR, defensive driving, again, all at discounted costs. If you use OcuScreen, it's essentially kind of a one-stop shop, and they have a contractual 3-day agreement to get those records back to you. And then essentially by doing the courses on the Motive Care site and using OcuScreen, you're done with your credentialing when it comes to driver vehicle, or I'm sorry, just driver. For the vehicle, we come out and do an inspection. So you just let us know when you're ready to schedule.
Okay. I'm just writing this down. Okay.
And if you want to just throw your email in the chat, I can get those to you right after this call.
Yes, ma'am.
Now, if you've already started the process using another company that's not OcuScreen or what Motive Care hosts, that's fine also.
I haven't. I've been checking around. Won't nobody tell you anything, you know. Don't nobody either know about it or they won't tell you nothing.
Yep, I'll send you a detailed outline with all of the links as well.
Okay, thank you.
You're welcome.
And Sherry, does that help with the NC tracks? I'm not sure if Denisha was asking a question related to credentialing through tracks or through Motive Care.
Denisha, are you enrolled currently with NC Tracks?
Yes, we are. I'm actually work at a family care home, a family owned care home that my brother run, but this is not, you know, it's going to be two different things. And we're going to actually try to do this transportation, medical emergency transportation together. But then we're just going to apply for a new MPI number, but I do know how NC tracks work and all that. But I didn't know who would be paying, you know, the non-medical transportation providers, you know, once everything is set up and you're good to go. Will the payment come from NC tracks or would it come from Motive Care?
So Motive Care as the broker model, all of your trips are going to be coming from Motive Care. You're going to be billing Motive Care and Motive Care will pay you directly. In North Carolina, we pay every week. So as long as you're on top of your billing, you can expect revenue coming into your operation every Friday.
Okay, so we will be provided to do our own a site to do our own billing, and we'll be required to do our own billing.
You will be, but again, you're going to be on an ATMS platform, which is essentially as easy as 1, 2, 3 click billing. You're not going to be doing a lot of manual key entry.
Okay. All right. Okay. I think that's all the questions I have.
Yep. And when it comes to the ATMS platform, again, we offer WellRide at no cost to you. You're more than welcome to use any type of software that you'd like, but WellRide is free to you. And you do get a rebate with every trip that you service for that. We provide you with all of the training. It's just an app you download on your phone. We provide you with all of our essential billing training. If something were to happen to the ATMS platform, you'll resort to the Motive Care portal. But we will provide you with all of that training.
Okay. Thank you.
You're welcome.
Good questions. Any others? Last call. All right, hearing none. Again, we want to thank you for participating in this training. And thank you, Motive Care, for providing the training for us. As I said earlier, we will go ahead and send out a recording of this. It will also have the PowerPoint slides attached, so you will have the information you need to reach out to Motive Care directly. I thank you, and I hope you have a wonderful rest of your day.
Thank you.
So much for
Thank
joining.
you.
Thank you, guys.
You all-
Appreciate it.
Abby? Are you still on?
Yes,
Can you just, for whatever reason, I can't copy and paste that of the chat box. Will you send that to me via email, those email addresses so I can get those
Yes.
out? Thank you
yes,
so
I
much.
will. Mhm.
Well, to the partners team, again, thank you for putting this together. And I will reach out to all of those. If anyone would like to be CC'd on these emails, please let me know.
Okay, yeah, no, we will just get an update on the spreadsheets Toby shares with us. And we will include you on the recording and what we send out to the providers. So again, thank you very much for pulling this PowerPoint together and for helping us with this effort.
Oh, absolutely. And thank you for your help with the effort.
Thank you.
You're
And
welcome.
Thanks, Abby, for pulling it together for us.
No problem. I'll have you this stuff over here shortly. It won't take me
Okay.
too long.
Perfect.
Thanks.
Thank you.
Bye.
Bye.